Welcome to Coaching Healthcare Leaders, where we transform great physicians and healthcare professionals into exceptional leaders. I'm Dr. Lisa, an executive leadership coach dedicated to helping healthcare leaders navigate the complex intersection of clinical excellence and organizational leadership. My mission is to give healthcare leaders a voice to help build sustainable health systems where everyone feels valued, healthcare workers want to stay and grow, and patient outcomes improve. Each episode, we'll tackle real challenges faced by medical leaders like you, provide actionable strategies, and feature live coaching sessions with healthcare leaders. Let's grow together. Hello, everyone, and welcome to the Coaching Healthcare Leaders Podcast. I'm your host, Dr. Lisa, and today I have an amazing guest with me, Dr. Joel Kahn. So I'm going to read his bio, introduce him. We'll talk a little bit about his background, and then we'll get into some interesting questions. So Dr. Kahn is an internal medicine and lifestyle medicine physician who has been exploring the intersection of business, healthcare, and technology for more than 25 years. He has run both startups and Fortune 500 companies at multiple levels, including president, COO, CMO, CIO, executive vice president, and board member. His passion is leading companies to grow their business and find solutions to improve the health and wellness of their clients, with a focus on executive management, operations, compliance, analytics, technology, and their application in the healthcare and wellness industry. As the founder of Wellness Health Medicine, he has been studying the effects of mindfulness and lifestyle medicine and how that impacts the health, wellness, and executive functioning of people through coaching and mindfulness-based techniques, where he works with individuals looking to achieve their maximum potential. So welcome to the podcast. I'm so excited that you're here and can't wait to get into some questions with you today.
Right. Thanks for having me on.
Yeah. So the first question I think is, one that I ask all of my guests is, tell us a little bit about your career journey. It sounds very interesting. You've had some experience in some leadership roles and sort of, now morphed into more health and wellness. So tell us about that leadership journey and who or what may have impacted you to this point.
Right. Well, I think as with many people, there's a couple inflection points that occur in one's life, sometimes planned, sometimes not planned. I'd always thought I was going to go into medicine from a family of doctors and was going to do that. But I got very much into music and recording and production work. And one pivotal moment was a decision as to whether or not to stay into film and music or go into medicine. And I decided on medicine. One summer after first year of medical school, decided to stay and do research instead of working on a film. And that got me doing computer work. And I was programming a computer, an Apple III, which no longer exists.
Wow.
And I started getting into that, and that led me down the software path. And so by the time I got into residency, I was programming software for the intensive care units and doing all sorts of different things, which was a lot of fun. But, and I thought I may go down that path. And then the FDA started regulating software because I don't know if people, this is going back in history, but there's a number of people that died on radiation beds on scanners. Who were getting radiation therapy. And so the FDA came into it in a big way. And I said, well, I've never been formally trained. All I've done is stuff on my own. So I went and got a fellowship in medical informatics and started down that path. And then coincidentally, I was hired working for an insurance company who decided they wanted to start a unregulated healthcare division. So we started a company called IntelliHealth, which was at the time, happened to be at the time of the bubble of the first tech bubble in the late 1990s when the internet was just getting started. That was very exciting. That got me into the business side of things because we were building this company. It was the #1 health site in the world and very exciting. Nobody knew what to do with it. And that really got the business bug into me. I was doing a lot of population health stuff, evaluating, the impact of healthcare and health knowledge and how the transfer occurs and how do you evaluate what's quality healthcare, what's not. Oh, I shouldn't say healthcare, what's quality health information and what's not quality health information. And continued down that path. And then I've been working on in a variety of companies since then, and but always as an executive. I kind of pulled out of taking care of patients and continued to run healthcare companies. And then the next big transition was when I was working for a company doing mindfulness programs, and we were doing applied mindfulness programs for the for corporations. So we were selling it through health insurance companies, doing it through large corporations, applied programs for stress and cancer and pain. And the chief science officer of our company was a coach
Mm.
and an academic one, and was doing research on that. And I thought it was really fascinating what she was doing and how that worked and the impact it had on the science of how to help people change their behavior and where they're going and what to do. So I went and got certified as board certified as a health and wellness coach and continuing on that path and taking some additional classes. And started a business doing coaching. At this point, I still do mentoring, advising for a variety of companies and help them out at a variety of different levels. But then have really focused on the coaching aspect. And I coach both patients as well as clinicians and executives who are doing business, development and life coaching.
Yeah. Yeah, wow, that's a very interesting story. And it's interesting because I think that, you know, like you mentioned, there have been little sections along the way that sort of guided you to where you are today. And it's great how you can now incorporate everything that you've learned and experienced into your health and wellness coaching, practice.
Yeah, yeah. No, it's you never know where some of this knowledge comes from and what different people relate to, uh,
Yeah.
because they all pick, a piece of it. But having a variety of backgrounds and doing a variety of things does help me, I think, sometimes to appreciate the struggles that people go through.
Oh, absolutely, absolutely. Yeah, and a similar story, I also had an experience with a coach that impacted my life and my career as well, and sort of led me down the path of coaching. So it's interesting to always hear other coaches' stories of how they entered, the field of coaching through having that positive impact with another coach. So, yeah.
Yes, and I see you're a PCC, and I'm just getting my PCC now. So,
Yes, 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 and just keep going, keep going.
yes.
We have a lot of work to do. So tell us, what does the day in the life look like for you? Who do you serve? And then what challenges maybe do you face?
Well, my days are still, split in a variety of places. So I'm typically coaching for part of the day, and doing some research and evaluation of things I'm going to be working on with people.
Mhm.
And as I mentioned before, I try to carve out a little bit each day because I'm doing a little bit of mentoring and advising as well. So carve out some time for that. And then I still do, believe it or not, I'm still doing a little bit of clinical work because I do a little bit of disability exams and that kind of stuff. So and I spend a little bit of time doing charts and stuff. And I have to say that it keeps me, because I wasn't doing clinical work for many years, got back into it. That has got me back into the drudgery and the pain and realizing the what people are suffering with trying to get the charting done through technology, which is um, a systemic problem for
Yeah.
clinicians.
Yeah, absolutely. Yeah, and I think it's good to share that, our, career doesn't have to be focused on one thing. that we can expand and do a lot of different things that we like to do in order just to have more fulfillment, in our day and in our career as well. So good that you can get back into a little bit of clinical medicine and sort of add that, to your plate of things that you're doing as well.
Right. Yes. And part of what I do is work on compliance work. And so there's a uh, never ending changes in compliance and technology.
Yeah.
So I spend a lot of time thinking about how that is going to impact companies and what they have to do to stay ahead of it.
Yeah, absolutely. Tell us a little bit about your coaching. So, how do you impact, the clients or the patients that you serve through your health and wellness coaching?
Well, um, I I really have two types of clients, I guess, for the coaching. One is the regular patients, and I tend to differentiate and call patients the people I'm uh, non-clinicians and non-professionals, and helping them make a change in their life. So a lot of the people I'm dealing with are dealing with nutritional problems. They're dealing with either weight loss or weight gain. Some of them are athletes and they're trying to bulk up. Some of them are people that are overweight with a lot of problems and they're trying to lose weight and get off their medications. And so I focus a lot on helping them understand what their triggers are, what's bringing them to where they are, why they're acting the way they are. And sometimes they're really simple solutions. Sometimes it's a lack of knowledge of how their body works,
Mhm.
what to do. They may have been told it in the past, but it never really sank in, or no one really spent the time helping them to understand it. And so I spend a lot of time on that. My focus on that aspect of the coaching is to get people off of their medications as much as possible.
Mhm.
And then on the clinical side, I tend to work with a lot of healthcare professionals that are either burnt out
Mm.
or tired of what they're doing, and they're looking for a career change, or they're looking to better understand how they can be happy or at least not so upset with
Yeah.
the career they're in. And helping people acknowledge, their situation, understand the boundaries of what they can and can't do, and what they can live with and what they can't tolerate. And, that sometimes helps them feel comfortable being right where they are.
Mhm.
And at other times, it moves them to a decision that, okay, yeah, I really do have to change. But before I make a decision on changing, what would make me happy? And
Right.
how do I find out what would make me happy? And how do I experiment with that? And how do I learn what other options there are?
Yeah.
And, that takes a little bit of time to help people work through that and get them feel comfortable with a change.
Absolutely. Yeah, I agree. I think it's really necessary to have that period of exploration where you're actually, looking at all the pieces, to the puzzle. Why did you get burned out in the first place, right? What makes you happy? What fills your cup? What are you passionate about? Before ultimately making that leap and making that change.
Yeah. And I think a lot of, especially clinicians, they've spent most of their life doing one thing
Yeah,
and one thing only, and they've really never developed other activities or other things to help them explore, what makes them happy.
absolutely. Yeah, absolutely. Well, thank you for the work you're doing in that space. It's really important, and the more I think of us that can, lend a hand to helping with the physician burnout is definitely needed.
Yeah, yeah. It was I've worked on the computer systems and uh worked to make what I think are better systems, but at the same time, I wasn't using them on a day-to-day basis until I started going back into clinical practice, really using them and realizing that yeah, it's painful.
Yeah, yeah. And having that insight is important to coach someone through that. So, yeah,
Yeah.
most definitely. Um, so you talked a little bit about your current role and how you impact, your current patients and clients. So what do you still see as some challenges for us in healthcare, and what are some suggestions that you might have in terms of how we might deliver better care or take better care, of the healthcare professionals who are in it?
Well, I think, well, there's some very large issues in healthcare. Obviously, AI is the big one right now, and um, I think that is still playing out. But it's interesting because when I was doing software development in the 90s, we were doing programs that were diagnostic tools. So you would type in the symptoms and it would spit out the differential diagnosis. And the concern was, oh my God, these computers are taking over for physicians, right? No, you won't need physicians anymore. And in a sense, that was true because we did some of these programs were used on nuclear subs where they didn't have physicians and they were underground and out of communication for months at a time, and they needed something. Um, but AI is one of those things that's starting to be used as chatbots. It's starting to be used for artificial coaches, for virtual coaches, for all these things. And where that's going to end up is unclear. I don't think I don't think we're going to lose coaching jobs. There's going to be, if anything, I think it's a rising tide. And I think people are going to be more aware of how coaches can help.
Yeah.
And there was an interesting study that just came out showing that actually talk therapy
Mm,
is starting to come back into vogue because people are realizing that drug therapy isn't not necessarily the best, and there's a combination that needs to be there. So I think there's going to be some combination of chat bots and real coaching that's going to come into play. Um, but I think from the standpoint of what the biggest challenges are from as a health coach and what I'm doing is really getting people to understand that there's a science to helping people navigate behavioral change, um,
mhm.
and that there are ways that you can help someone make decisions. A lot of people are trapped in their anxiety and their nervousness, and they're afraid to do things, and especially clinicians tend to think they know everything, and so, well, I can't figure that out, so therefore it can't be done.
Right.
um, which isn't true, right? And so there's lots of techniques out there to really help someone, and I think helping people understand that there's options out there is really important.
Absolutely. Absolutely. Yeah. Well, thank you for sharing that insight. I think it's important for, people to understand, like you mentioned, that they do have options and to seek out, the help where they can. And certainly, getting a coach is one of those areas where I think, definitely physicians especially can have someone who can understand the path that they're on and help them to make those decisions.
Right. Yeah. No, I don't think, I mean, it's interesting. Some of the larger healthcare systems are starting to pull in coaching,
Yes.
but they're not really using it as coaches. They're more using them as, I don't know, as people that to just help, kind of in a glorified case management
Hmm.
uh, for the patients. And they're running some check box things for their clinicians to help them do something. So, they're starting to they recognize it's an issue. They're starting to do some things, but I don't really think they've yet fully absorbed that.
Yeah, exactly. I think it's more understanding it from a standpoint of personal and professional development as opposed to performance evaluation, right? Or performance type of review. So yeah, most definitely.
The one thing I have been happy with is the fact that so many medical schools now are starting to, granted it's still small, but they're starting to actually teach nutrition
Yes.
and teach preventive health. So listen, it's baby steps, but they're great. It's starting to catch on a little bit, and hopefully the shift towards preventive medicine will continue to grow, and physicians hopefully will feel comfortable talking about that to
Yeah,
their patients.
absolutely. Absolutely. Well, this has been a wonderful interview. And to wrap up, if you could just give the audience a couple of tips, one or two tips around how to still thrive in the face of adversity, but still take care of yourself.
You know, continue to focus on the basics of self-care. Continue to get exercise, which is super important and super hard for someone who's running nonstop, taking care of people.
Yeah.
Um, I think that it's really important to manage the stress levels. So whether it's, you do it through meditation, you do it through exercise, you do it through socialization and talking to people and doing things, but, make sure you spend time for yourself so you don't get burned out and that you feel comfortable. And then the last thing would really be to keep your eyes open for opportunities that come up. You
Yeah.
never know where they come up. And saying yes and saying, "Hey, that sounds interesting," is a great way to continue to have a fun life.
Yeah, absolutely. Absolutely. I love those. So thank you again. I'm looking forward to continuing to follow you and to learn more about what you're doing. How can people find you?
Well, the website is wellnesshealthmedicine.com, and you can reach out through either info or Joel at wellnesshealthmedicine.com. And I'm more than happy to take questions and talk. And, networking is really important. So if you're just exploring and you want to understand what this is all about, just give a call and we'll take it from there.
Okay, wonderful. Well, thank you so much and enjoy the rest of your day. It's been wonderful speaking with you.
Thank you. Take care.